So, ang topic ko na inassign sa akin is about Palawan Eye Center sa Paningin Initiative, yung program namin na ini-implement dito sa probinsya ng Palawan. But aside from that, may inatasan din akong i-define, no? At para ating alamin ano mga parameters ng visual disability. Sino ba ang pwedeng maklasify na may disability, no? May visual disability. And of course, yung pangalawa is yung about sight-saving initiatives ng Palawan Eye Center. So let us go first to the laws. No? I'm sure karamihan sa inyo alam nyo na yan. No? Republic Act 7277, yung Magna Carta for Disabled Persons. Republic Act 9442, Protection Against Ridicule and Vilification. And yung Republic Act 11228, yung PhilHealth for all persons with disabilities. So lahat ng mga itong batas na to ay para protektahan yung mga taong may disabilities. And of course, we have a lot of disabilities. And it is not under this discussion anymore. So it's important for you to understand na lahat kayong may visual disability ay entitled na right away without having to pay for any PhilHealth premium or PhilHealth benefits. I hope lahat kayong mga may visual disability ay may PhilHealth membership na po, no, sa ngayon. Okay? So kung wala pa, lumapit lang po kayo sa local na tanggapan ng municipal or city office para mag-apply ng yung WPD ID. Then you can go straight to PhilHealth office for the issuance of PhilHealth membership. Now, I will be discussing about this DOH. DOH means the Department of Health Administrative Order Number 2013-2013-005-A. So ano tong document na to? Dito kasi naka-define kung ano nga ba ang visual disability. Oops. So sa visual disability, importante yung tinatawag na visual acuity. Ano ba ang visual acuity? It's a measure of how sharp or how blurred the vision of the person is. So, yung linaw, no? Yung linaw ng paningin. At kina-quantitate ito kung gaano kalinaw ang paningin ng isang tao. So meron tayong dalawang systems, no? Yung metric system at saka American system. So sa clinic, I usually use the American system. So American system uses 20 feet as the baseline. So di ba meron tayong 20/20, yun ang perfect vision, o 20/63, gano'n, no? So pag nakita nyo yung 20 na number, usually American system yon. Tapos meron tayong metric system that uses 6 meters as baseline. So 6 yung kadalasan na ginagamit, no, sa metric system. Pag hindi na kaya na makabasa nung pinakamalaking letra do sa Snellen or sa EDTRS chart, pina-quantitate na lang ito kung counting fingers, so nabibilang lang yung daliri, or nakikitang gumagalaw ang kamay, o kaya naman as in nakikita lang ba liwanag o wala na nakikitang liwanag. So example lang, pag ang nakalabel sa paningin ay 6/18, no? Ulitin ko, 6/18. Ang numerator o yung number na nasa taas, no? Numerator, no? Is the distance a person can read or can see compared to a normal person. Then the denominator, yung number na nasa baba, is the distance a normal person can see or read. Ano lang kayo na chat kung sakaling medyo mabilis ang aking pag-deliver, no? So now, gusto kong maano nyo yung example lang. which has better visual acuity? 6/18 or 6/60? So, ang denominator, pag mas malaki, ibig sabihin, mas malabo ang paningin ng tao. So, sa example na to, 6/18 compared to 6/60, mas malabo po ang paningin ng 6/60. Okay? So, how about sa American system naman, 20/63 or 20/200? So, again, denominator, pag mas malaki ang number, mas malabo ang paningin. So, sa 20/63 compared to 20/200, mas malabo ang 20/200. Now, darating tayo sa visual disabilities now, no? Number 1, ang prerequisite ay visual acuity after treatment or intervention. So, ulitin ko, no? Importante na after treatment or intervention. Anong treatment? Pwedeng eyeglasses lang o pwedeng operasyon. So, depende na sa anong klaseng sakit meron ng pasyente. No? So, importante na may intervention or treatment. Visual acuity in better eye of less than 6/18 for low vision. Ito ng parameters, no? Kailangan ang visual acuity ng better eye ay less than 6/18 for low vision, no? And 3/60 for blindness. Yun ang ginawa ng DOH as a sort of classification, no? Or criterion. Another option is for visual field of less than 10 degrees. Anong visual field? Ano bang meaning of visual field? Imagine, yun yung lawak, no? Lawak ng nakikita natin. Now, for example, your visual field kasing laki ng bond paper. So, bond paper, mga 13 inches by 8.5 inches. So, kunwari lang na ganun kalaki ang lawak ng paningin nyo. Pag less than 10 degrees, ang paningin ay halos less than 1 inch. 1 square inch ang paningin na naiiwan. So, na-imagine nyo yung liit na lang ng paningin, no? Now, iba rin naman ang legal blindness, no? When we say legal blindness, that's 6/60 or less than 20 degrees. So, mas less stringent yung ng legal blindness. Mas stringent yung qualifications ng DOH. Now, scenario 1. Patient came in requesting for certification of visual disability. So, di ba, siyempre, gusto rin natin magkaroon ng benefits, lalo na kung tayo may problema sa paningin, no? If the vision is 6/18 in right eye, 6/18 in right eye, and 6/6 in left eye. So, di ba ang natin, pag 6/18 ay considered as low vision na siya. Tapos, yung kabilang mata, no, is 6/6. Qualified ba siya sa visual disability? So, ang sagot ay sa qualifications kasi, ang pinag-uusapan ay ang better eye. So, in this case, ang better eye is 6/6. So, strictly speaking, hindi siya qualified. Now, may binigay kasi na question about paano kung one eye na lang ang tao. Consider pa na visually disabled ang tao since 50%, no, one eye is blind, other eye is not. Sad to say, using the DOH qualifications, no, yung criteria, hindi siya qualified. But I always tell my patients, although strictly speaking, hindi ko qualified, pwede mo naman pakiusapan. Kasi nasa pakiusap lang naman. I have patients who were given PWDs because of yung humanitarian consideration na hindi mahirapan silang maghanap buhay o makapasok ng trabaho simply because of blindness in one eye. Now, darating na tayo sa part 2 no ng aking discussion. So, I would like to share with you ano yung programs na ginagawa ng Palawan Eye Center Sagip Paningin program. So with regards to the Sagip Paningin, meron tayong pre-permanent disability tasks. Ano mga to, no? It's I have established a network of referral system so that these far-flung rural clinics, health centers will be able to refer patients to me. Importante rin yung mass education. So once in a while, I will visit radio stations to discuss about eye diseases. And I engage in early detection and treatment. So siyempre pag ang sakit mas maaga natuklasan, mas madaling magamot at na-avoid natin ang maging mabulag yung mga pasyente. And I have established some satellite clinics to cater more to the patients. Can you imagine yung ang haba-haba ng province ng Palawan? It's about 400, halos 480 kilometers mula dulo hanggang dulo. And yet, the ophthalmologists were concentrated only in Puerto Princesa City. So meron akong itinalagang satellite clinics sa El Nido to cater to patients from the north at sa Batarasa to cater to patients from the south. And of course, at Palawan Eye Center, we offer free consults for PWDs, indigenous, indigent, and even the senior citizens during afternoon clinics. So that's a pre-permanent visual disability task that I do. Now with post-permanent disability tasks, pagka halimbawa nagkaroon na ng low vision yung tao or kaya naman nabulag na, we will do counseling first. Importante kasi maintindihan ng tao, ng pasyente, no? Bakit kailangan na ma-train? At importante na ma-involve yung family. Madalas na-encounter kayo na gusto ng pasyente na mag-undergo ng training and yet the family does not want to. Especially in the first part, no, nung ako'y umpisa mag-practice pa lang, resistant yung, let's say, magulang simply because of poverty or inconvenience sometimes, no? Kung minsan, inconvenient lang o to kaya naman ng pamilya na tustusan yung pamasahe. So, importante yung bakit nila kailangan mag-effort para sa kanilang kinabukasan. And that visual disability, especially when the person is blind, is not a limitation for him to become a productive member of the society. Pangalawa dyan, after the counseling will be low vision aids, no? Na i-explain ni Dr. Onshaco. Then third, nowadays we already have the blind support group. Nung nag-uumpisa ako ng practice, asing wala talagang support group ang mga bulag o mga low vision. Nowadays, I'll just refer the patient to blind support group. In that way, na nabubuhayan ng loob yung pasyente na, nga pala, may pag-asa pa, meron pa tayong pwedeng magawa. Pwede pa ako maghanap buhay kahit ng bulag na or low vision. Almost 14 years ago, I have started the At ito mga pag-uusapan natin, ito yung mga training na to, no? So, once na low vision or bulag na yung pasyente, anong gagawin natin? So, meron tayong mobility training kung saan tinuturuan yung mga pasyente na gumamit ng white cane. So, nagkatak ako ng trainers program. That's way back almost 2006. So, mga 14 years ago. Training the trainers program with Miss Milagros Waino of RBI. So from that time on, meron na kaming program for mobility training. Okay. So at the start, yung mga trainers, they were blindfolded when eating, and even they have a practicum going to a grocery, blindfolded, as in from the seminar place, pumunta sila ng grocery or supermarket, then going back, blindfolded. So, na-realize ng mga trainers how important it is na may paningin tayo. Because sometimes we take for granted yung paningin natin, and pag biglayan nawala, grabe ang depression. So that's where we started, and so far that program is still ongoing. Meron kasi sila ang nakipag-tie up kasi ako sa Bahatala Foundation, which is headed by Ma'am Cecil Socrates, and she has a rehab personnel to train the blind or low vision persons. We also have this Android Labs Bulag program with Brother Ernie Heredero. At dito sa program na to, dito na kami nagkakilala ni Brother Ernie. So we have already produced roughly about 30 trainees. I can remember na there was one young trainee. At the start, resistant siya. Ayaw niyang mag-train. Kasi feeling niya parang wala nang pag-asa ang kanyang buhay. Para ano pa? I did some surgery, but unfortunately it did not work out. So malabo ang paningin niya. But through the support and the moral support of his mother, umaten siya. Sa unang araw, medyo nababagot siya. Pero at the end of day 1, parang medyo may nakikita na siyang konting linaw, no? Nag-enjoy na siya. And soon, after the training, and that training lasted 5 days, natuwa siya kasi at least may nakikita na siyang liwanag in terms of what he will do for the rest of his life. Okay. Then we also have the computer applications under the auspices of thru in Manila. We do have occupational rehabilitation. Kasi importante na hindi lang makalakad ang bulag, hindi lang makagamit ang cellphone, kundi makasupport din sa sarili niyang pangangailangan. So this occupational rehabilitation is important for his personal independence, no? Yung independence ng blind people. So we have vocational training, yung pagmamassage, yung pagkanta kung siya ay mahilig kumanta. So actually meron na kaming combo ngayon na this blind combo is being headed by Mr. Renante Paigma. I think umattend rin siya sa meeting na to. And I have several patients. By the way, si Kuya Rene is also a masseur. So nag-training din siya ng pagmamassage. I have a lot of patients who are already members of the Vibe Center for Massage. And I also offer hindi lang vocational training but also college scholarships. So far, natuto ako 2 years ago. Meron na akong teacher who is now a full-fledged teacher. Nag-graduate siya ng education at nagtuturo na po siya ngayon. Okay, that's all for my talk.